How to assess your hearing loss risks. Assessing your risk for hearing loss is an important step in maintaining your auditory health. Understanding the factors that contribute to hearing loss can help you take proactive measures. Let's dive into what you need to know. First, consider the common risk factors for hearing loss. Noise exposure is a significant contributor. If you work in a loud environment or enjoy concerts, you may be at risk for noise-induced hearing loss. Age is another factor. As we get older, our hearing ability naturally declines, a condition known as presbycusis. Certain medical conditions, like diabetes or cardiovascular diseases, can also increase your risk. Lifestyle choices, such as smoking or taking specific medications, may elevate your chances of hearing loss. Additionally, using personal protective equipment, like earplugs, inconsistently in noisy settings can further increase your risk. To effectively assess your risk, you can use indices that combine these factors. These indices consider your age, noise exposure levels, medical history, smoking status, and use of protective equipment to predict the likelihood of hearing loss. Next, it's essential to undergo hearing screenings and assessments. Start with a subjective risk assessment. Discuss your exposure to loud noises, any family history of hearing loss, and symptoms like difficulty understanding speech or experiencing ringing in your ears, known as tinnitus. A healthcare provider will perform a physical examination to check for earwax buildup, infections, or any structural issues that could affect your hearing. Simple screening tests like the whispered voice test or tuning fork tests can provide initial insights. For a more detailed evaluation, audiometric tests conducted by an audiologist measure your hearing thresholds. These tests assess both air and bone conduction to determine the type and degree of hearing loss. In more complex cases, advanced tests like auditory brainstem response testing or auditory steady-state response testing can objectively estimate hearing thresholds. Regular hearing screenings are particularly important for those with known risk factors, such as occupational noise exposure or age-related decline. Early detection is crucial as it allows for timely interventions that can prevent further damage and enhance your quality of life. While some mobile apps and screening tools can offer preliminary information, a comprehensive assessment by hearing health professionals is essential for accurate diagnosis and management. In summary, assessing your hearing loss risk involves evaluating personal and environmental factors, undergoing appropriate screenings, and consulting healthcare professionals for tailored advice. Being aware of these risks and seeking professional help when needed are key steps in protecting your hearing health.